This is Dr. Anna Maria Mihalta. I'm president of AM Medical LLC in Yale, Washington. Today's topic is about reversing chronic fatigue, discussing mitochondrial dysfunction and the thyroid connection. There are many chronic fatigue causes. Underlying chronic diseases certainly are contributing, as well as adrenal fatigue due to chronic stress. Mitochondrial dysfunction is the inability of the mitochondria to appropriately produce energy and have problems in the way they are supporting the cell with ATP, which is the molecule that produces energy in the body. The gut microbiome is very important, and when that is abnormal or people develop leaky gut, the immune system is affected and inflammatory compounds are released in the bloodstream. The higher inflammation is, the lower cellular voltage is. Cellular voltage is the electricity in the cell, and in order for things to be functioning properly, the voltage needs to be high. So there is an inverse correlation between inflammation and electricity in the body. Low thyroid function is extremely important cause to address in chronic fatigue because there is the hormone connection in which the thyroid is in charge of metabolism and energy production. Type 2 hypothyroidism is a syndrome just like type 2 diabetes where people are making the thyroid hormone, but their cell is resistant to the effects, and so they are still clinically hypothyroid. DHEA is a precursor hormone to the sex hormones. Out of DHEA, people make estrogen, progesterone, and testosterone. DHEA is also an anti-aging hormone that has been shown in conjunction with metformin, a blood sugar lowering agent, to increase the volume of the thymus gland. So thymus gland is extremely important for anti-aging purposes because it is what has regulated the biological clock in the human and immune function. It involutes after people become teenagers. Depression and anxiety have profound effects on immune dysfunction and cause chronic fatigue. There is increased inflammation of muscles and joints. This is a general inflammatory syndrome in the body, which basically means that the body's aging rapidly. So the higher the inflammation, the more accelerated the aging process, and inflammation is what mediates and causes the development of chronic diseases like heart disease, cancer, dementia. Food allergies and food intolerances also cause inflammation and can be related to chronic fatigue. SIRS is chronic inflammatory response syndrome. Mold illness, Lyme disease, and co-infections all cause chronic fatigue symptoms. Other viral infections like EBV, HSV, and others also have been implicated. The MTHFR mutation is the inability to utilize B12 and folate vitamins. The methylated form needs to be utilized in people who have the specific gene defect. Thyroid hormones are really important. There's a number of them. So the pituitary produces thyroid stimulating hormone, and then the gland itself makes T4. T4 gets converted into T3, which is biologically active, and there's another pathway where out of T4 reverse T3 gets made, which is biologically considered inactive. So if a person makes a lot of inactive thyroid hormone, then they may be hypothyroid. There are other mechanisms in which there's a problem transporting the thyroid hormone across the membrane. There are two other thyroid hormones, T2, which has been shown to regulate the metabolic rate, burns fat, it protects kidney function, it improves blood sugar, and improves cholesterol, and T1, of which the action is unclear. Standard tests to check the thyroid in mainstream medicine, usually free T4 is being done in a TSH. Those are inadequate to really assess thyroid function, and many people who suffer from hypothyroidism are not adequately diagnosed with that testing. So in integrative medicine, we also look at T3 to the reverse T3 ratio, which is looking at, well, how much active and inactive hormone are you making. That ratio should be greater than 20. Also, it is important to look at antibodies against the thyroid. For example, Hashimoto's, an autoimmune thyroid dysfunction. These antibodies can be evaluated, thyroglobulin antibodies and thyroid peroxidase. There are people who have all of the symptoms of low thyroid, brain fog, chronic fatigue, and they also have a low basal temperature. So first thing in the morning, you take the temperature and it's less than 97.8 degrees. Historically, that has been used as a potential indicator of low thyroid function, because those people with thyroid problems feel typically very cold. They can't get warm even if people are comfortable around them. They have cold extremities. And because thyroid hormone is in charge of the temperature regulation in the body, this can be another sign. The thyroid hormone has to be transported across the cell membrane to perform its active duties inside the cell. That transport mechanism is energy dependent. So if your mitochondria aren't making enough energy, then the transport of the thyroid hormone into the cell is also impaired. So you develop an intracellular low thyroid state with seemingly normal blood tests, and then people are still tired. So there's many patients who go to the regular doctor, they get their lab tests, the labs look all fine, but the patient is still tired and nobody can tell them why. So oftentimes it is because people haven't been looked at in depth in regards to their thyroid physiology. Chronic fatigue and mitochondrial dysfunction are related. In severe chronic fatigue, the mitochondrial dysfunction has been clearly shown in studies, and the more severe the fatigue was, the more severe the mitochondria were not working properly. There can be a tremendous amount of symptoms with thyroid dysfunction, from acne to actually accelerated arteriosclerosis. There was a physician by the name of Broda Barnes in Chicago who looked at a cohort of 2,000 patients that he gave bioidentical desiccated thyroid hormones, and the rate of heart attacks was substantially reduced compared to the studies done on people who were not on thyroid hormone. Constipation can be a thyroid dysfunction symptoms. Fatigue, dry skin, heart palpitations can be common. Thyroid dysfunction has been associated with cardiac autonomic neuropathy. That's an abnormal firing of the sympathetic nerve fibers to the heart, and related to increased risk of heart arrhythmia. Recurrent infections like boils can be a sign of thyroid dysfunction. High cholesterol, brain fog, premature aging, really, because again, thyroid is in charge of mitochondrial energy production, and when that's downregulated, the aging process is quite fast. PMS can be significant. Headaches, migraine headaches have been shown to respond very well to thyroid hormones. This is also in Dr. Barnes's cohort of 100 patients with migraine headaches, and he had response rates of over 95%. Intolerance to cold, again, this is related to the thyroid is in charge of the body's thermostat. Mood disorders, obviously when people are fatigued, they start feeling depressed. Low cellular voltage is exactly related to the mitochondrial dysfunction. Cystic ovaries are also correlated with thyroid dysfunction. Gout is a problem that develops with thyroid dysfunction, low immune function, as well as arthritis. So once the thyroid hormone is replaced, a lot of the stiffness, the pain can improve significantly. There's a difference between using bioidentical hormones versus synthetic. So synthetic hormones are like levothyroxine or Synthroid. This just has T4, and it is a chemically related T4. It is not bioidentical. T4 still needs to be converted into T3, and a lot of people with chronic conditions or endocrine disruption due to toxicity like heavy metals make a lot of reverse T3 and not as much active T3. So they oftentimes need more help, and I have tested a lot of people who are on levothyroxine who still have T3 to reverse T3 ratios that are consistent with hypothyroidism, even though the rest of their lab tests are normal. So I use bioidentical hormones like Armour or Nature Thyroid. They contain all of the 4 hormones, T4, T3, T2, T1, calcitonin, iodine oftentimes, so that these hormones are more related to our own physiological functioning. T2 itself has been shown to increase resting metabolic rate, so a lot of people who are unable to lose the weight, who still feel fatigued, and have this chronic achy pain in their tissues, they benefit from having T2. It works directly on the mitochondria. It does result in weight loss. It increases the body temperature, so those people who feel chronically cold. It has been shown to lower cholesterol and improves insulin resistance. T3 has been shown to resolve fibromyalgia symptoms. These effects were shown in when T3 was given compared to placebo, and they were looking at multiple markers of fibromyalgia, and they were given supraphysiologic, so higher doses than usual of T3, up to 150 micrograms, and these patients maintained improvement, and in fact all of them resolved their fibromyalgia symptoms, period. So it is thought that the low thyroid actually causes a accumulation of a gel-like substance in the tissue. It has been known as myxedema, and that causes this aching pain when people are touched, for example, on their arms. It hurts them, so this can be resolved with appropriate thyroid hormone replacement. So thyroid and mitochondria are related in the sense that T3 actually determines the mitochondrial density per cell. If you think about that, a muscle cell is about 200 mitochondria. A heart muscle cell has 5,000 mitochondria per cell. So if there's dysfunction, there can be definitely significant effects like, heart failure and heart rhythm abnormalities and all of those things that we previously discussed. And so T2 stimulates these mitochondria and then regulates mitochondrial activity. Thyroid function assessment is critical to reversing chronic fatigue. There are other things that obviously also need to be done. Nutritional optimization, looking at vitamin deficiency like vitamin D, vitamin C. Minerals need to be adequately replace the correction of adrenal fatigue. The adrenal gland is very important and it goes hand in hand with the thyroid. Oftentimes when people have adrenal fatigue and you replace thyroid, you can have difficulty. So treatment of both is important. Thyroid replacement should be done with appropriate labs and then following clinical symptoms. Endocrine disruption needs to be reversed as best as possible by detoxifying heavy metals with chelation or taking into account other environmental toxins that could be adversely affecting the patient. Oftentimes we use other modalities like vitamin C infusions, peptides, different nutraceuticals with anti-inflammatory properties like curcumin and others. Again, in order to decrease inflammation, which adversely affects cellular voltage and thereby causes chronic fatigue, we need to address the underlying cause of this rapid aging, which one of its symptoms is the chronic fatigue. I hope that this was useful information. If you would like to hear more, you can find us on our website at ammedicalmd.com. You can follow us on Facebook and on our YouTube channel, AM Medical LLC. Thank you for watching.